habang tumatagal, they're having more symptoms of pains and heavy vaginal bleeding. And we are very fortunate that the St. Luke's Medical Center now has a non-surgical treatment option. No cut, no incision. Actually the first and only one to date in the Philippines.
Good day everyone, I'm Dr. Jing and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. Good day everyone and welcome back to MD in Focus. Today we're shining the spotlight on a common yet often misunderstood condition affecting women's health, myoma, which can significantly impact a woman's quality of life. Joining us today to shed light on this important topic is Dr. Sandee Go, an obstetrician and gynecologist from St. Luke's Medical Center. Dr. Go is also part of the country's first and only specialized facility offering high-intensity focused ultrasound, or HIFU, a cutting-edge, non-surgical treatment that targets and destroys solid tumors, both benign and malignant. So let's dive right in. Hi, Dr. Sandee. Thank you for joining us today. Dr. Sandee, to start off, could you tell us more about myoma and adenomyosis and how these affect our patients, or your patients rather?
So myomas and adenomyosis are basically the most common tumors of the uterus, affecting around mga 30 to 50% of the population in the reproductive age group. So
a lot. Like almost half of the women in a room would have myoma.
So basically, when you say myoma, there are capsulated tumors made up of muscle cells. And then adenomyosis occurs when the endometrial tissue, which is normally found in the lining, infiltrates the myometrial wall, causing the thickening of the myometrium. So basically, myomas and adenomyosis may cause problems with the patient's menstruation, heavy vaginal bleeding, prolonged period. Patients would oftentimes have dysmenorrhea. Patients would have a higher incidence of infertility. And if they get pregnant, it's very common to have pregnancy complications like miscarriage or preterm deliveries.
So the most frequent symptom would be bleeding, or yung sobrang dami ng regla, or sobrang haba, excess bleeding, okay. And then it can also have an impact on their reproductive health, like pwede palang hindi mabuntis.
Yes.
Or makunan, or then get miscarriage. So what are the main reasons why some women have myomas, or myomata, pag plural? So what is the main reason, or what is the usual cause of a myoma in a person or in a female?
It's multifactorial. The exact cause is really not well established, but we can see major factors that affects the growth of the myoma, like hormonal, for example. That's number one. So we know that myomas and adenomyosis have receptors, mga hormonal receptors, and so they respond to hormones. So any condition that would have a high levels of estrogen, for example,
they might have more chances of having myoma.
It's the reason why mga patients in the reproductive age group would be expected to have increasing sizes of the myomas as against to a menopausal patient who do not have any more estrogen. So in those instances, if they reach menopause, the myomas will be expected to gradually shrink over time.
So parang pag nag-menopause na pala ako, yung mga myoma ko, quiet down na, liliit na sila. But do they disappear when you menopause?
Gradually, yes. It depends on the size when they reach the menopausal stage.
So, any other possible cause, or is it really just hormone?
Genetic. That's the reason why sometimes we see mga magkakamag-anak yan with myomas or adenomyosis. Usually you would elicit from them history from their relatives. Yes.
If a person has myoma, is the treatment always surgical, or how do we treat myoma in general? Or are there different kinds of myoma first before we proceed with treatment?
So it would depend first and foremost on the symptoms of the patient. So we find out from the patient whatever symptoms they have, and then what the goals are specifically for the patient. So for example, there are cases when fertility would be a concern, So of course we're going to be more cautious and conservative. Yes, so there are medical treatments for myoma that we can try first, If for example, they are controlled already with medical treatments, then they do not actually have to resort to any other treatment. So surgery is an option also, especially here in St. Luke's. No, they can be assessed for the possibility of surgery like open myomectomy, or we have here minimally invasive surgeries already. Like laparoscopy and robotic, and it's a good thing now that we have in the hospital a non-surgical treatment option now, which is the high-intensity focus ultrasound. Yeah.
Non-surgical.
Non-surgical, no cut, no incision. Yes. And this is actually the first and only one to date in the Philippines.
Can you tell us more about the HIFU for myoma?
When you say HIFU, it's basically a non-invasive treatment modality where the machine will be capable of focusing ultrasound beam. No? So ultrasound siya, basically that will be focused inside the patient's body, and then once we focus it inside the patient's body, there will be an increase in the temperature in that area to cause what we call coagulation necrosis, or basically the destruction of the cell of the myoma and adenomyosis. So once na-target na siya and there will be the destruction, then whatever we ablate, no, that's the part that will gradually shrink on its own. So there's no need to remove it, there's no incision, there will be no blood loss. And our procedure, yes, and our procedure are all done on an outpatient basis. So they go home. We usually do procedures in the morning, and then in the afternoon they can go home.
So it's not painful as well?
There's a slight pain, discomfort that the patient would feel. No, that's the reason why they will be on light sedation. Yes, just light sedation, but with minimal discomfort. The recovery time very fast. We just ask the patient to rest for 3 to 4 days. Unlike if they're going to undergo a surgical intervention, no? So they just rest for 3 to 4 days, and then they come back to us after 1 week after the HIFU to check what's targeted, and then they can go back actually to their normal activity.
Doc, what are the advantages of HIFU for the treatment of myoma and adenomyosis?
So since HIFU is a non-surgical, non-invasive treatment modality, no, so there will be no incisions, there will be no scar, no blood loss. The risk of infection will be minimized. No? And then, like what we mentioned, this is done on an outpatient basis under just light sedation, so they can go back to work because of the short recovery time. No? And then very important also advantage will be the preservation of the uterus. They wouldn't have to undergo hysterectomy, especially for cases of adenomyosis, where usually the last definitive resort will be hysterectomy for them to be relieved of the bleeding and the pains. No? A good treatment option for those kinds of patients. No? So, and then the safety also of the procedure. So this is a very safe procedure with very few complications, because we'll be able to determine the possible side effects at the onset during the screening. And so we'll be able to screen them well, and then we won't anymore accept patients who would have possible side effects with the procedure.
Doc, what would you want to say to our listeners who are hesitant or uncertain in going to like a physician like you?
Yes, so I would really understand their hesitation when it comes to going to the hospital and consult, because of their fear to having a surgery and the fear of the unknown in general. No? So it's very important for them to understand that myomas and adenomyosis are common conditions, and with the advancement of healthcare, of women's healthcare in particular, no, there are many options that can be offered to them depending on their needs, specific needs, and depending on their goals. Because it's not like we just give treatments to them, no, left and right. It depends also on what they need and what they would want also.
For themselves. So wag matakot. Kasi I think other people may be scared of knowing what they have, no? And you really would want to know that there are so many technologies now in medicine, and not everybody will have to be operated on. Hindi lahat hihiwain, and there's so many advancements. Why should women consider St. Luke's Medical Center for their health care?
St. Luke's Medical Center, of course, offers a unique combination of a cutting-edge technology, we have specialized expertise, and we have a patient-centered philosophy. So in our unit, at the HIFU unit, we're going to do the same kind of patient-centered approach. It's very important for us that we know what the patient wants, what their problems are, so that we can establish the goals of the treatment. So that patients who come to us will be assured that they're going to be well taken care of.
Thank you for joining us today on St. Luke's MD in Focus. I'm Dr. Jing, and I hope this episode helped shed light on uterine fibroids, what they are, how they affect women's health, and why early diagnosis and proper management matter. Remember, awareness is the first step to empowerment. If you or someone you know or someone you love is experiencing symptoms, don't hesitate to consult your doctor. Let's continue the conversation, support one another, and prioritize our health. Until next time, stay informed and stay well.